Okay, now we're going to do a short video to refresh everyone's memory on how to put a walker boot on. You'd get this if you had a ankle fracture or foot or ankle injury.
All right, so we're fitting the Air Select walker boot. We've removed the front anterior panel, which we want to do before we put the boot on. We haven't inflated any of the chambers. So we just open it up all the way. There are socks inside the boot that can be used if you want to for the patient. So we have a size medium here, which is probably a pinch too big for Brandy, but we always want to make sure that the toes aren't hanging over the front too far. The way this boot works then, we want to set the cover over it like that, and then the toe cover comes over. And before we do the straps, make sure we put the anterior panel back on. So we don't inflate any bladders until we put the anterior panel on. It slides in there gently. You don't have to crank that too tight because we're going to use those bladders to do that. I like to slide the bottom one in first and hook that. Again, snug but not too tight because we'll use those bladders to really snug it up. Make sure you tuck your plastic pieces in there slightly between the bladder and the plastic. Again, snug but not too tight. And finally, the top one here. The anterior air bladder on this panel that we had removed is pre-inflated, so you don't have to inflate that. And then there are 3 bladders that we're going to inflate. You can see the dial has a 1, 2, and a 3. And then the bulb right here, the bulb is no longer removable, it's integrated, and this is the release. So here's the bulb to pump it up, here's release. The bladders are all labeled, so you know which bladder you're inflating. 1, medial or lateral side, depending on which ankle you're dealing with. The 2 is the opposite, and the 3 is the posterior bladder. All right, so we have it on number 1 here, so I'm just going to usually start with 4 or 5 pumps just to patient comfort. I'll move to number 2, do the same thing, and then number 3, and then get some feedback from the patient if that's too snug, if it's not snug enough, if they don't feel it yet, and we'll do a couple more in each bladder to make sure that that's snug but it's not too tight and not compressing them too much.
Perfect, thank you.